The Brain Foundation has provided 2 epilepsy awards this year, both funded by the Michael Rogers Sterling Estate. And the first award is to Dr. Christopher French from Royal Melbourne Hospital and the University of Melbourne for his project, How Do Anti-Epileptic Drugs Work?
Your Excellency, members of the Brain Foundation, distinguished guests. Firstly, of course, I would like to thank the Australian Brain Foundation for their very gratifying support with this award. It will make a great difference to our projects. Epilepsy is a common, immensely disruptive and occasionally fatal disorder affecting about 1% of the population. Drug therapy will prevent seizures in about 70% of patients, but about 30% of patients remain medically refractory. Despite many years of use, we remain surprisingly ignorant of exactly how anti-epileptic drugs work. Therefore, there is both a major deficit in effectiveness and knowledge which go hand in hand to prevent us treating epilepsy adequately. Research from our lab has found that some of the most commonly used drugs seem to be working quite differently from the commonly assumed mechanism. This grant will allow us to pursue these intriguing observations through electrophysiological, molecular biological and computational experimental techniques. Our aim is to find better drugs for epilepsy. This is quite exciting, for if these findings are confirmed, they will probably apply to a wide range of other medications such as analgesics, local anaesthetics, cardiac antiarrhythmic drugs and so forth. I just want to say on a personal note, it's a very poignant moment for me to be here back at the Great Hall of my alma mater in the presence of some of my colleagues over many years. So I really couldn't let the occasion go by to thank people who've been so helpful over the years, and in particular of those who've been so gracious and generous to me in my medical and research studies. So first of all, Professor Anne Sefton is here this evening, who I did my BSc Med with in the Anderson Stewart more than 10 years ago. And then as I would say, my informal mentor, Professor Bogdan Dreyer, who's here as well. I'd like to also mention particularly the late Professor Peter Gage, with whom I did my doctoral studies, as I had nothing more than being an enthusiastic fourth-year medical student at the University of New South Wales. Professor Peter Barry at the University of New South Wales, who graciously allowed me to complete my doctoral studies in his lab after Peter Gage moved to ANU. Jumping ahead, I'd also like to acknowledge particularly Professor Jim Colbatch and Matthew Kiernan, who took me on for my neurological training at the Prince of Wales Hospital in somewhat more recent times. And latterly, when they took me on in Melbourne, which was a little bit unusual, Elsden Story, in particular David Brutons at Monash. And most recently, I'd like to really acknowledge the help of Professor Stephen Davis, Head of Neurology at Royal Melbourne, and especially Terry O'Brien, who's head of my unit, for his extraordinary encouragement, mentoring and friendship at the Royal Melbourne Hospital and the University of Melbourne. Finally, I wanted really to thank the students who've done so much of this work, in particular Megan Oliver, Gail Garcia, Zhen Zeng, Daniel Chan and Wan Xing Ling, and my co-investigators Alyssa Hill and Zhen Zeng. So thank you very much for the award and for your attention. Thank you.